Hi, it's Wellness Wednesday. I'm Leisha, tobacco treatment specialist, and today I'm going to go over just kind of a general overview of some prescription medications that can be used in tobacco treatment. So first off, I just want to say I'm not a doctor or a pharmacist, so please consult your primary care, your doctor, and or your pharmacist if you have more questions, concerns, or would like more details about these medications. Okay, so the first medication that I wanted to talk about is Varenicline, which is better known as Chantix. It is very common in the tobacco treatment world, and most people have heard of this one because it's been on TV, commercials, that kind of thing. But it's very well tolerated, it's easy to use, it is a pill form. The one thing to know about that one is sometimes it does cause some nausea or sleep disturbances. So you just have to be aware of those things when thinking about Chantix. The second one I wanted to talk about is Rupoprian Sr. This one does have a generic as well, so that can kind of help with price-wise. It's easy to use too, pill form, not many side effects. It can be paired in combination with over-the-counter nicotine replacements like patches or things like that as well. The only side effects that are the most common are dry mouth and insomnia. The next two I want to talk about are a little less known or talked about in the tobacco treatment world, but one is a nasal spray. So it has nicotine in it, and you would spray it in your nasal cavity. So the nicotine is absorbed through your lining in your nose, and it's easy to dose as far as that goes. You can kind of use it as needed throughout the day. It can be a little bit difficult in the sense that you have to frequently use it to keep the nicotine levels consistent to what is adequate or what you may need for withdrawals from nicotine. So the next one is a nicotine inhaler, and this one is has nicotine in it that you inhale through your mouth, so it's absorbed through your lining in your mouth. And you just want to know that you shouldn't inhale deeply as far as trying to get it in your lungs. You really just want to puff. And this one is very easy to dose, so you can use as needed throughout the day. Some people do find that they are maybe using it more often than they would actually a cigarette, and that is pretty normal, just because you do have to use it frequently to keep your nicotine levels where they need to be throughout the day. So some of the maybe negative things with that might be is throat irritation or mouth irritation with the inhaler. And I just wanted to kind of plug with all of these medications. They all do require prescription, so like I mentioned at the beginning, it's very good to talk to your doctor about those and what might fit the best for your health and for other health history that you may have or things going on with your current health. Also want to mention all these medications, they do help and either help with withdrawals or helping get through those cravings a little bit better. But behavior change is also super important with all these medications to help you be the most successful that you can be in your quit attempt.